Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of our flagship stations 89.3 Lakes FM and Civic Center TV. Civic Center TV on Comcast, Channel 15 and AT&T Channel 99. Also on TV in Birmingham, Bingham Farms, Beverly Hills and the village of Franklin. We're on Birmingham Area Municipal Access. That's also Comcast Channel 15, AT&T Channel 99. We're on the web, civiccentertv.com. Click on our Watch Live link on the homepage or watch on the small player that is also on the top right of our homepage. And as always today on Facebook, our Facebook partner today broadcasting live is my co-host on her journalist page, Ronnie Dahl.
Tyler, how was your weekend?
The weekend was pretty good, Ronnie. A nice and relaxed weekend. At least I tried my best to do some relaxing. Yeah.
Yesterday the weather was
Yeah, weather wasn't so great yesterday. It kind of went up and down and mostly down, but overall, I'll take a mostly sunny and mostly enjoyable weekend outdoors over anything else.
I was so excited, though. Tyler, this is how you know you're getting old.
Uh-oh.
So excited to see my hydrangea bushes starting to get little leaves. I mean, come on. When you're in your 20s, are you even thinking about that?
Not really. I mean, I don't know a whole lot of 20-year-olds that have a whole lot of flowers being planted in their yard. Most aren't having yards. I know a lot of people my age that have plants at home and are very much into their plants and the upkeep of their plants indoors or on a patio or on a balcony or whatever the case may be. But I don't know a whole lot with flowers in their yard that are getting excited about that. But for those that do partake, it's a good time. It's that time of the year.
I go out and I talk to them.
To the plants. You talk to the plants. That's fine.
To my, really my hydrangea. And so to the deer, my hydrangeas are off limits.
Of course.
You can nibble on the other plants. Last year they ate all my hostas. You can nibble on that stuff, but leave my hydrangea alone.
Of course. Something has to be sacred. You can't limit what the deer and what they're going to do. This is their environment too. They've been living outside all around here, and we've built on their land. But there's got to be limits, right? You gotta have some limits. Let's cooperate here.
So we were online last year because they were eating them so much. We were trying to come up with ways to keep them, away from the plants, but to do it in a safe way. And so there was some website, and you take like a bar of Dial soap, and then you hang it on near the bush. And it supposedly keeps the deer away. I will say, I think it worked because they survived last year. We'll see if it works again this year.
Yeah, maybe they'll get used to the strategy, find a different way around, or just ignore the soap altogether. Or it's going to be different deer, and they'll fall for it too. But you got to do what you can to keep your plants safe and keep the other animals out there from going ahead and eating all of them, because otherwise they will. I mean, that's just their nature.
So, as the saying goes, though, April showers bring May flowers.
That is true. Very true. And we're certainly getting into the April showers portion of the month for sure. It's taken about 5-10 days into the month to really get out of the pre-summer summer preview weather and get into the regular April weather, although still much hotter than it normally is at this time of the year.
So sadly, though, this April is pretty much a lot like last year April, because we're seeing another surge in the coronavirus cases. It was all the talk. Michigan numbers yesterday on all the Sunday morning talk shows. We are, making national news right now because of our surge in our cases. So for the 7th consecutive week, our COVID-19 cases have continued to rise. So Saturday, there were nearly 7,000 new cases, 74 deaths reported on Saturday. Today we'll get the numbers for Sunday.
Yes.
Today. So the latest figures bring the state's total number of cases to just over 738,000 cases, deaths to 16,500. And said that those numbers are, since last March. The percentage of COVID-19 tests bringing positive results has been rising for 6 weeks. It's at 18% right now, the highest since the spring 2020 surge. And of course, the cases among kids, we've been talking about at ages 10 to 19, have been on the rise for the past 5 weeks, faster than any other age group as outbreaks continue to rise in schools and youth sports. From January to March, there have been 291 outbreaks from youth sports, resulting in at least just over 1,000 infections. That's according to the chief medical executive, Dr. Jonay Khaldun. Some hospitals right now canceling elective surgeries and limiting visitations because of the surge, which, that was happening last year at the beginning.
Yeah, that's something that was happening at the beginning of this pandemic, and it really hasn't gone back to that point, although the hospitals have at certain points during other surges been worried. I don't think they've been in this sort of, I don't want to call it panic mode, but severe worry mode at the very least, where they're shutting down other operations or beginning to put those on pause to focus entirely on the COVID-19 situation. This is something we haven't really seen since the very beginning, and with our positive case rate, as it's been reported over the last 6 weeks, now being at 18%. That is a staggering rate, as we were really getting close before these surges to getting down under that level where you would see evidence of community spread. Last week, Dr. Khaldun explicitly said in the press conference on Friday that there is evidence of broad community spread across the state.
Right. It does look like a lot of schools, as well as youth sports, are not going to be taking that 2-week pause that the governor has been suggesting they do.
Yeah, almost immediately after that press conference, or at least immediate for our purposes here as we get off the air at 12 noon. About 12:30, I was just scouring social media of those in our local area in Oakland County, athletic departments and school districts, to see what their reaction would be immediately, because in some cases they do get this information in advance of these press conferences, and several school districts direct from their athletic department had said by that point in time that we're not going to suspend our sports. Now, a lot of these sports at this point, the winter sports, are coming to an end. Actually, they ended over the last weekend, and now they're into spring sports. The vast majority of spring sports are outdoors. And so that's part of that reason, and it's not state mandated. It's merely just a suggestion. The MHSAA is not recommending that sports be paused, although the state is, and individual schools, some are going to take extra precautions, and others are going to politely say, no, if you're not requiring us to do that, we're going to move on as is. Our students need this.
So one thing that could help, Pfizer is asking the FDA to okay its vaccine for kids ages 12 to 15. Pfizer and its German collaborator BioNTech asked the U.S. Food and Drug Administration to allow their COVID-19 vaccine to be used on adolescents ages 12 to 15. Now, the vaccine is already authorized for use for 16 and up. The companies also plan to ask for similar authorization from agencies in other parts of the world. In trial results released recently, the companies showed that their vaccine prevented all COVID-19 symptomatic disease, and trial participants aged 12 to 15 generated large numbers of protective antibodies in that age group and did not pose any safety concerns. The companies will follow all of the more than 2,200 trial participants for 2 years after their second dose to make sure that they are okay, and also to make sure that the vaccine is actually working.
Yeah, this is something even beyond this particular trial for ages 12 to 15, but all their trials, they're going to continue to follow their test patients for years afterward as they continue to learn more about these vaccines. Again, these vaccines are in their infancy. They were created rather quickly to be able to get us through this process and hopefully out of this pandemic as soon as possible, and declared safe for ages 16 and up as of now through the FDA. Getting to ages 12 to 15 would definitely help to get into that 10 to 19 problem area in the state of Michigan. It would be something that I think the governor and the Department of Health and Human Services, if this is deemed safe for that age group primarily, would be very happy to hear, and probably would then double down on their ask to the federal government for more vaccine, probably even more Pfizer. As they've been asking mostly for the single dose, but if a 2-dose vaccine like the Pfizer vaccine is in fact viable for younger ages 12 to 15, that's something I think that the state government would continue to ask for from the federal level, although there is no indication right now that the federal government will will come through and agree to that.
So this could really help with the spread in the
Yes.
sports as well, if we can get some of the kids vaccinated. And, you really have to think about all the heroes that have been signing up to basically be a guinea pig for this vaccine. And I know that way back in the beginning when we were talking about the vaccine and the trials, there was a lot of talk and a lot of focus. But since the vaccine has been out, people are kind of forgetting about the all the individuals that volunteered to help get us to this point.
Yeah, and you never know when you go into these trials as a participant if you're going to end up with a safe medication, with a safe vaccine, or if it's going to be something that simply doesn't work, or it could be potentially harmful. So people that did volunteer for this, for the greater good of not just our society here locally in Oakland County or in the state of Michigan or in the U.S., but really for the world population, are doing a great service to humankind as we're going into, as we were early on in the pandemic when these trials started, and now as things are getting further along and we're getting these vaccines to a larger group of people, the ability for these people to have taken some sacrifice and said, I'm going to do this for the greater good, has gotten us to this point a lot quicker than we probably would have been otherwise.
So we told you recently about how showing your vaccine card can get you free things.
Yes.
One being Krispy Kremes.
Of course.
But now, how about a free beer?
Yes.
So, free beer for your COVID vaccine. Sam Adams has announced the new incentive. So, if you get a COVID shot, you can get a free Sam Adams beer. The beer brand released a new national TV spot. Your cousin from Boston gets vaccinated to help combat skepticism amongst drinkers with humor and announced the hashtag #ShotForSam vaccine incentive program. So a couple of things, though. The free beer for the COVID-19 vaccine offer starts today and is for the first 10,000 drinkers who share evidence of their vaccination on social media by May 15th or while supplies last. So a vaccine card or medical information, though, is not required. The beer brand suggests showing like your I'm vaccinated sticker. We've seen those, or like a bandage photo with the hashtag #ShotForSam on Instagram or Twitter for a chance to receive $7 cash through the Cash App to cover a Sam Adams of their choice from their favorite local bar or restaurant. So winners will receive direct messages, the beer brand says. To learn more, just go to samadams.com. People are buying into it already.
Yeah, and if these things are working, then good on these companies for putting that extra little incentive out there and doing their part. I mean, I don't know how many more people that were apprehensive about getting a vaccine that a Krispy Kreme donut or a Sam Adams beer, if you're over the age of 21 and will drink responsibly, is going to incentivize people to get a vaccine. But if it does work in some cases, then it is doing a community service. And I wouldn't be surprised if we continue to see more brands locally and national brands as well try to get in on this as we get further along into the vaccine process. It's something to talk about. It gets the people talking. I mean, not only shows like us, but others locally and nationally talk about stuff like this. And any press is good press, especially in today's day and age, and companies like Sam Adams that really don't have a whole lot of PR going year round. That is getting national press. This is something that I think a lot of companies are going to try to follow in the footsteps of.
So if you look at Twitter, it is all over the place. We do want to remind people, though, if you're going to be posting a picture of you with your vaccination card, be sure to cover up your personal information, because we know there are so many people out there scamming, trying to get that information, because usually it has your legal name and your date of birth.
Right, or better yet, just take a picture of the I'm vaccinated sticker. You do the same thing on election day. We're not taking a picture of us holding our ballot with all of our information filled in there. No, we're taking a picture of our I voted sticker. Let's do the same thing with these vaccines. Take a picture of I'm vaccinated, or just a picture with the with the bandage on your arm after you get the first and second shot. That gets the job done. It lets everyone know what they really need to know without putting your personal information out there.
So, like they said, some people are getting these cute stickers, so it's like your I voted sticker.
Yes.
Now, some places are starting to give out, I'm vaccinated stickers.
Yeah, and again, it's a really nice way to show that, hey, I'm vaccinated without giving out that personal information. Join in on the fun with everyone else that's getting vaccinated, showing that, hey, I'm doing my part and I'm along in the process. But, making it safe. And on top of that, free stuff comes with it too, here and there, if you decide to take advantage of some of these promotions from local and national brands.
Oh, some people even got cute Band-Aids.
Oh.
So if all you have to do is search #ShotForSam on social media to see everyone posting. They're going to go through that 10,000 pretty darn quickly.
Yeah, it's going to be pretty quick. I think their deadline was May 15th or while supplies last. I highly doubt supplies are going to last through May 15th. The campaign begins today. Today is April 12th, and that's when it begins. I don't think that lasts very long, maybe a couple weeks max, but I don't think it gets to May 15th by any means.
So with that, too, it's also a good way for people to be able to support their local restaurants.
Yes, good way to do that also, because that money is still going to the local restaurants. It's just that Sam Adams is basically pre-reimbursing you for paying for that beverage. Of course, if you're over 21 years of age, if you're 21 years of age or older, and of course drink responsibly if you partake. But you're still able to support your local bar or your local restaurant and go get a Sam Adams beer with that incentive that they've provided you through #ShotsForSam. And of course, only the first 10,000 begins today and goes through May 15th at the max.
Okay, so now I'm getting obsessed over these stickers that people are getting. The New York Mets. They did a vaccination site.
Very nice.
At their ball field, and so their sticker looks like a baseball.
Very nice.
Cute.
Very on theme. I wonder if the Lions would do that for the Ford Field vaccination site now. Maybe take some inspiration. I got vaccinated, now I can draft a wide receiver. I don't know, something like that.
Right? Yeah, exactly.
The Matt Millen theme, I don't know.
But of course, as always, you can get the latest headlines. Go to civiccentertv.com, click on coronavirus. So we post the headlines each and every morning. And also, when you read it, if you click on the headline, you can get the full article as well. We're going to take a quick break here on the Megacast. It's Monday. We're starting the show off with a good lineup today. Speaking of beer, we're going to have on the founder for Loaded Dice Brewery a little bit later in the show in the 11 o'clock hour, so we'll talk to him. They have a very interesting story on how they got started. So we'll be talking to him, and then also the mayor for Rochester Hills will be with us, Oakland County Community Engagement Manager for the Detroit Institute of Arts, the DIA. We'll be speaking with her in the 11 o'clock hour as well. The DIA recently did have to close for a little bit because of the surge in cases. So we'll get a check-in from the DIA to see how things are going there. And then also 10:40, Dr. Chen will be with us from Henry Ford West Bloomfield Hospital. I always like talking with the doctors directly because I feel like we get so much important information from them.
Yeah, we do. Yes, we do. And we get all this basic information, but it's good to dig a little bit deeper into it, get the why behind the what, and better understand things, because these medical professionals are able to give us details that we're not really going to get in a 30-second hit on the news or by reading an article by a journalist that is going to collect all that information from medical professionals but doesn't have that inside knowledge.
So, but next when we come back after the break, we'll be speaking with the enrollment manager over at Oakland University. Tough times right now to be a college kid, but also for so many people working in the colleges, trying to navigate this, get students enrolled, but also keeping them safe at the same time. So we'll be checking in with Dawn Aubry right after this quick break.
COVID-19 has caused many families to fall behind on finances and on groceries. But you're not alone. You shouldn't have to worry about putting food on the table. MyBridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping, taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Right now, our country feels divided, but there's a place where people are coming together.
I was nervous to talk to someone so different than me.
Me too.
Love Has No Labels and One Small Step are helping people with different political views, beliefs, and experiences connect through conversation, and it feels good.
This conversation gives me hope.
It gives me a lot of hope too.
Take a step toward bringing our country and your community together. Start a conversation at lovehasnolabels.com/one small step. A message from StoryCorps, Love Has No Labels, and the Ad Council.
Great to have you with us on the Monday edition of the Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. As a reminder, we're here Monday through Friday, 10 a.m. until noon. You can catch us on Civic Center TV, Birmingham Area Municipal Access. Also, if you have cable, find us on Channel 15 if you have Comcast, 99 on AT&T, but you can also listen to us on the radio, 89.3 Lakes FM, 88.1 FM The Biff. These are tough times for parents and students, especially college students. Both my niece and nephew are in college right now, and there's been so much talk and debate about should students take a gap year? Should they not take a gap year? If you're going to be remote or not, or in-person learning, so many things for so many parents and their students to try to navigate right now as we are a year into this pandemic. But fingers crossed, by the time fall rolls around, we'll be able to get back to some type of normal in our lives. And to talk a little bit more, let's bring in Dawn Aubry. She is the VP for Enrollment Management at Oakland University. Dawn, great to have you with us.
Good morning. So excited to be here. Thank you for having me.
So how are things on the campus right now?
Things are going really, really well. We're doing everything we can to ensure a safe return to campus and to residents' life this fall. So our team is busily preparing to make sure that we have everything in place so students can have as close to normal of experience as they would like to have. And of course, for us on campus, our faculty and staff are really excited. And as many of you might know, we've actually been holding vaccination clinics for free for faculty, staff, and students to help them prepare to be more safe and be ready to engage in both classes and activities.
So much is being done to navigate the virus and to keep people safe. Did you guys have a spring break this year?
We did. And, we, I think, did everything we can to keep things safe. Our spring break was in February, so it's a little different from most of the Michigan public universities. And fortunately for us, there wasn't a lot of spikes at that time, but we did return, and folks did return online first to help accommodate that. So I think we were really prepared to make sure that we could have a safe return. And I think maybe if you recall talking to us earlier, most of our classes were already being offered online. We had very few in person for the winter semester.
So as we go into the summer months, I know there is a lot of focus into the fall, and many colleges and universities are going to require their students be vaccinated. Is Oakland University taking that same route?
Well, we actually just announced last week that we are going to require vaccinations for students who choose to live in the residence halls. So only about 20% of our students do choose to live on campus. We don't require it, where I'm sure you've seen many universities in Michigan do require certain populations to live on campus, where Oakland does offer that choice. And of course, we respect that there are families that might have religious or medical reasons, and we have a process. So folks can go to our Dean of Students office and share with them if they have a medical or religious reason, which would prohibit them from participating in vaccination. So I feel like we're doing everything we can to keep it safe, and I think we're being very responsible.
We're talking with Dawn Aubry. She's the VP for Enrollment Management at Oakland University. And Dawn, how are enrollment numbers looking right now? Are they up, down, flat?
Sure. Well, I think as we talk with our peers, I think we all are just very anxious to see how it will play out. So many campuses experienced declines in application, and Oakland was one of them. However, in our yield activity, in the activities where we have students participate in signing up for orientation, things are looking much stronger this fall compared to last fall. So we're very, very positive. Official enrollment really can't be shared at this time because most of our students haven't attended an orientation. So for example, our freshmen and our transfers, most of them will be attending orientation in late May through August. So that will always help us have a better enrollment picture. But with our current students, we are seeing great registration activity for them. And I'm excited. I think as we start to see the numbers to come down, which of course we just saw a spike, I think families will be more prepared to make their decision as vaccinations are rolling out and they're going to see the data. I do believe folks will make a decision. So we've had to be very flexible with our whole process. And I'm sure you'll see from many universities, but Oakland has taken the lead in offering opportunities for families to take time and to make a great decision. And we're helping them do that in a variety of ways.
So, Dawn, we know that a part of the process for so many students to decide which college they go to is that popular on-campus visit. Did those take place?
They did. And honestly, most of them were virtually this year. There was a time where we were able to offer in-person tours in August to November. We were able to give very small campus visit tours. But most of our activity has been done virtually, and it's been very successful. We've had strong attendance, lots of engagement from our new admitted students and families. And we're still doing those. And I honestly think that even when things return to normal, we'll still offer many sessions virtually for families that have found that to be a great way to engage with us when they maybe can't get to campus. But we're looking forward to offering in-person tours again when it's safe to do so.
So what is the thought process in the fall when it comes to athletics?
Well, I think one of the things is we'd love to return to having spectators back on the fields and in the stands again. And we're doing everything we can to make that possible. And clearly, encouraging folks to get vaccinated is one of the ways, and still wearing masks and, having some social distance. We're very serious about following the guidelines that have been provided to us. And I think our athletic department has been outstanding in trying to minimize, risk to their athletes and to our spectators. They're already talking about what they could do to make that happen. So we also work closely with the NCAA as well. So I'm feeling confident that we'll have great plans in place to make everyone feel safe.
Yeah, because Grizz wants to get out and cheer for the team.
Absolutely. He's excited. You can see I brought him here with me today, but he's absolutely excited. He's also excited to talk about the chatbot that we just implemented to help folks find out information about Oakland University and help them in making their decision to attend OU.
So tell us more about that.
Absolutely. Well, we have a brand new chatbot, and it's featured at our website, oakland.edu/future students. And basically, you can ask Grizz general questions about Oakland University's admissions, the registration process, and even financial aid. And it's one of many ways that students can interact with us and ask questions in order to get immediate responses. And it's also a great way for folks if they want to interact actually any time of the day when staff might not be available. And if Grizz can't answer the question, our GrizzBot will have our staff follow up with the student via email or with a phone call. We can also share helpful links to resources throughout the university. So we're excited, and he's always learning new information, and we're going to continue to improve our responses over time. And it really learns the most common questions from students and families. So we encourage everyone to ask Grizz, and he will definitely prepare you to find out what is amazing about Oakland.
Grizz is one smart bear.
Definitely. He's
Sorry, I had to throw that in. Hey, we're talking with Dawn Aubry. She is the VP for Enrollment Management over at Oakland University, and you had brought up financial aid. So many families are struggling right now due to the pandemic. Are you offering additional financial aid? And what about students who maybe started and then their family's finances have changed throughout this crisis?
Absolutely. One of the things that Oakland is deeply committed to is supporting our students through to graduation, and financial aid is a critical component of ensuring students will have student success and actually graduate from Oakland. And one of the ways that we're committed is to making sure we have need-based aid. And of course, we have merit-based aid as well. But we decided during COVID to really up our game with our emergency grants, both from the institutional perspective. And then, of course, we've been provided with federal aid and did an outstanding job getting the emergency funds into the hands of our current students. So as new students come in, we are assessing their financial situation when they fill out the FAFSA, and we're able to determine, what need level they have. And the university has something called the Golden Grizzly Guarantee, which allows many students who have a lower EFC, $8,000 or less, to attend Oakland, pretty much loan free. So that has been very critical to supporting families. We also have need-based aid for transfer students as well. And current students, at any time, if there's a change in their financial situation, we have an unusual circumstances process that they can reach out to a financial aid advisor, and they will help them look at their situation and hopefully be able to adjust and secure them more resources. And then we have generous donors who have been really stepping up and helping us in a variety of awards and grants. So it's been an amazing opportunity for people to give back and support our students. And I do believe that that will continue this year and beyond.
So we know that there are scholarships and grants out there. They can take some time, though, to go through the application process. What advice do you have for students?
Sure. Well, at Oakland, it's pretty simple because when they're coming in as a new student, most of our need-based aid awards and our merit are automatic. So it's at the time that they apply, so they don't have to fill out a lot of applications. And we've also now, for new students and returning students, we have a new scholarship tool where they can actually fill out one application and fill out sometimes different questions for certain awards, but it's much more streamlined to simplify it for them. And of course, we do encourage students to look at their community-based organizations. Sometimes they're religious organizations. If their parents are affiliated with other groups or military organizations, there are additional awards that they can secure. And that does require some time filling out applications, answering questions. But, to me, it's worth it. If you can secure several $1,000s, that will help you, support your education and prevent you from taking out a lot of loans. It's definitely worth it. But we have folks on staff that will help coach them and show them some strategies, teach them some strategies on how to do that effectively.
Yeah, because, there is talk right now in D.C. about trying to come up with some way to relieve students of some of their debt because college is so expensive right now. So, and students need to be responsible when they are going to college because, if you're getting out and you're going into an industry where maybe your second job, you're only going to make 20-something thousand. You don't want to be sitting on $80,000, $90,000 worth of school debt. So be responsible when you're, trying to get these loans.
Definitely. That is something Oakland, we're very committed to educating our students to make sure they're not taking out unnecessary loans. Oakland's average debt is much lower than most of the Michigan publics and definitely much lower than the national average. And we like to keep it that way. And part of it is trying to educate students and families about what they should do and looking at their major and thinking about what is the salary you'll be making when you graduate and how are you going to make your payments. So those are all important things. But looking, long term, right? What is the cost going to be? And letting them know this is an investment, but it's one that, will pay off, but they do need to make plans. And sometimes you have to make some sacrifices, right? And make choices about what you choose to spend or invest your money in while you're going to college. And some folks, that can be challenging, right? We want immediate gratification. But I think, the college degree for most individuals, right? It gives you many more opportunities. It gives you many more options in life once you achieve that. But you do have to be aware that it will take investment in time to achieve those goals.
Do you anticipate in another year or two you're going to have an influx of transfer students due to, the program that's going on right now where the state is offering free community college to certain individuals here in Michigan?
Well, we are definitely seeing very positive signs of increased transfer students through the Frontliners program and through Michigan Reconnect. We've had many students already inquire about transferring to Oakland once they've completed their community college experience. So once they've earned their associate's degree. So we already have students this summer and next fall that want to transition to Oakland. And as you know, I think we talked at Megacast maybe about a month or so ago about our Frontliners Award. So that is definitely helping us. We're so excited that students are able to attend community college for free, and that way hopefully save that money to help finish and complete their bachelor's degree at OU. We've always been an institution that's been very transfer friendly, and I can tell you right now, things are looking good for summer and for fall. It looks like a lot of students are making the choice to come to Oakland, and I do believe that we're going to see that pick up as things return to normal.
So, Dawn, just another minute or so left with you here on the Megacast. Some parents are wondering if their child is taking remote classes and they're living at home, why should they pay out-of-state tuition fees?
Sure. Well, what's great about
I'm sure you get that question all the time right now, right?
I do. So out-of-state fees for us don't exist. We actually do in-state tuition for out-of-state students. So it's one of the great things about Oakland is that we do have a non-resident award for out-of-state students. So we charge one price for our classes, whether they're online or in person as well. We just have some variable pricing based on some of their course studies. So certain academic subjects, you're going to pay a higher rate for. In the upper class, the upper level courses, students' tuition does vary. But in terms of online, or if they're an out-of-state student, a domestic resident, they're going to pay the same tuition rate at OU. That is one of our commitments. And we've been able to do that because of our generous donors and the way that we've been able to set our budget. So thank you for bringing that up.
Yeah, see, you learn something new all the time. With that, Dawn, speaking of that, anything maybe I didn't touch on that you want to add before we say goodbye today?
Well, I just, again, want to appreciate the time today with everybody and just encourage folks that, if you have any questions about OU, we're always happy to help. The admissions team is, outstanding. Our financial aid and registration team is, always ready and willing to help. We are really prepared for whatever may come. And we have a unique student experience that is not going to be compromised no matter what happens with the pandemic. And we do believe Oakland University is still the best option for current and prospective students. So thank you.
Dawn, any advice for any high school seniors who are still working on their application? What do they need to put in it to be able to be accepted?
Well, it's pretty easy right now. It's really, you just need to fill out your online application and have your transcript sent. And right now we are test optional. So for students that did not take the test, they didn't have the ability to take the test, that won't prohibit them from attending Oakland, and actually many of the Michigan publics have done the same. So, we are ready. We can talk to any of those family members, those students virtually, and we'd be able to set up an appointment too outside of 8 to 5 if that works for them. We're really flexible. We want to support them through. We know it's been a challenging time, but we want to welcome them and get them excited for an amazing education at OU this fall.
Dawn Aubry with us on the Megacast, VP for Enrollment Management at Oakland University. Dawn, thank you again for your time.
Thank you, too. Have a wonderful day.
Go Grizzlies.
All right.
I will say the new Grizz looks a little scary.
He's pretty fierce. And, when you're a Division I team, you kind of have to have a scary mascot. But he's a pretty friendly guy.
Dawn, thank you again. We're going to take a quick break here on the Megacast, and when we come back, Dr. Chen will be joining us on the show. This is the Megacast.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine. Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
In times like these, we have to believe in each other.
And we believe that you'll do the right thing.
When it comes to stopping the spread of COVID.
Follow the 3 W's.
Wear a mask.
Wash your hands. Watch your distance.
And when it's your turn to get the vaccine, take your shot.
It all comes down to the golden rule.
Treat others the way you want to be treated.
We're so close, Michigan.
We can do this together.
We want to say thank you for taking time out of your Monday to join us here on the Megacast. It really is kind of alarming what's going on here in the state of Michigan right now. We have the highest rate of coronavirus infections here in the state of Michigan compared to every other state in the country. The surge is scary for so many people. And to talk a little bit more about this and so many other things, let's bring in Dr. Chen. She is the Chief of Medicine over at Henry Ford West Bloomfield. Doctor, thank you again for being with us.
Good morning. Thank you for having me here. It's a pleasure.
So as someone who is on the front lines, what is it like every day? We're a year into this. So many workers, you must just be exhausted.
It has been a battle, and there have been ebbs and flows, and we were doing quite well in the state of Michigan, about 2 months ago. And then I think a series of events that all came together have all contributed to the spike that we've seen now. And the numbers we have now are as high as we've ever had. And that's one of the most concerning things when you think about how we're doing. And I think it caught many of us people in the state by surprise, I would say. I'm not sure it was anticipated that this was going to be upcoming at this time. But I think we're ready for anything now.
Yeah, it's been a roller coaster ride. The one thing that is better, if there is, a silver lining in all of this, it's not the struggle that it was a year ago to get PPE and some of the other equipment needed. Absolutely. As healthcare providers and at Henry Ford, we've gained so much knowledge, especially in the beginning a whole year ago. And so our expertise and, all the care providers in the state, expertise in taking care of COVID is very high at this point. There still is the emotional toll of seeing our patients and our loved ones critically ill, and that's been hard. So with that, Doctor, do you want to talk a little bit about if someone is coming to the hospital right now, are restrictions in place right now at Henry Ford? Yes, in most facilities, we are limiting guests. We are not allowing visitors due to, again, COVID numbers being as high as they've ever been, even higher than the beginning of the pandemic. So just for safety for everyone, and not everyone in the population is immunized. So we do know that there is risk with some visitors potentially being a carrier of COVID, having asymptomatic COVID, or having symptomatic COVID. We just want to keep everyone safe. Dr. Chen with us here on the Megacast. She's the Chief of Medicine at Henry Ford West Bloomfield Hospital and also an infectious disease specialist. As a doctor, what is your take on the virus and how it is spreading across the country right now? Well, it's been devastating and has caused a pandemic, one we've not seen in almost 100 years. What we've seen more lately are new variant strains that have emerged in the last 6 months. And unfortunately, one of those strains, the B117 from the UK, has made its way not only to the United States, but to Michigan. And you may have heard or seen we have some of the waffling between number 1 and number 2 of the most cases of this new strain in the country. These new variant strains are thought to actually be more infectious, so they spread more quickly, and actually cause more severe disease, more severe cases of COVID. So while we are evolving and our best practices have continued to be fine-tuned and honed, the virus also is adapting and trying to evade everything we're throwing at it. So it's been a struggle, but one that we keep working at. So with that, Doctor, we hear so much about herd immunity throughout this pandemic and this crisis. Can we reach it, or will the variants always have us striving to reach it? I believe, in theory, we could reach herd immunity. And as you know, herd immunity, it's also called population immunity. It's when there is indirect protection from the COVID disease, when a very, very high percentage of the population is immune to COVID, either through vaccination or if we develop immunity through prior infection. Now, the World Health Organization and the CDC feel that it's unethical to let COVID ravage the community and develop immunity through infection. We would lose many, many millions of more lives that way. So we are trying, as you mentioned, trying to reach herd immunity through vaccination. So there's several barriers towards reaching herd immunity. We do have the new variants, but we have excellent science, and we are able, even our current vaccinations are thought to be somewhat or pretty active against the variants. But my concern actually of the barriers that would prevent us from reaching herd immunity are other things as well. So we know that until
everyone reaches herd immunity, we actually have to be careful with social distancing and following the rules. And many people have relaxed that vigilance, and we haven't reached herd immunity, so it's actually spreading the problem more quickly. So we're actually doing worse now than we were even before vaccination, because we have let down our guard and we haven't kept up that vigilance while we're waiting for everyone to get vaccinated. But I think the number one thing I'm most concerned about is that what we call vaccine hesitancy. There are many, many adults who have been offered the vaccine and who have declined. And so it simply is not going to be possible to reach any sort of herd immunity or protection for the entire population if almost everyone doesn't agree to take the vaccine. Current experts estimate the need for vaccination to range anywhere from 70 to 90% of the population needs to get immunized. And when you think that, 20% of our entire population are children, that would essentially mean almost 100% of our adults would need to get immunized. And we are so far away from that, even that acceptance of needing immunization and agreeing for immunization due to many different reasons. And so I actually think that is our biggest barrier. If we could convince everyone about the safety and the need to protect everyone through vaccination, and that's our best way towards returning to normalcy in the future, a better life for all of us in the future, we would have a better chance of achieving herd immunity.
So if the Pfizer vaccine gets approved by the FDA for emergency use for kids that are 12 to 15, do you think that would help us as a community try to reach this level?
I do think it would help. And absolutely. If you look now at one of the many driving forces of increasing the rates in Michigan, why we're number 1 or number 2 in the country for number of new cases as well as percentage of positive cases, it's the younger population. Anywhere from, we're seeing outbreaks in daycares, but every age group, 10 to 20, 20 to 30, 30 to 40, 40 to 50-year-olds, this entire younger population is driving the number of new cases. Early in the pandemic a year ago, most of the cases were in our most vulnerable elderly population, but many of those patients have now been immunized, and so the COVID infection has now spread towards the people who are not immunized, which is essentially everyone under 50, and even many 50 to 60-year-olds, but 50 and under is where the driving force is right now with new cases. And so by being able to immunize everyone, even down to 12-year-olds, hopefully in the near future, I think that would help prevent the spread within our community.
Dr. Chen with us here on the Megacast. She's the chief of medicine over at Henry Ford West Bloomfield Hospital. And with that, doctor, I have to ask, because every time I go on social media, it is like everyone is either in Florida or Tennessee or Texas. I mean, they're all traveling, even some people crazy enough to go to Mexico right now. But we're hearing like some of those states don't have the numbers that we have here in Michigan, and they don't have the restrictions, and they've lifted their mask mandate. What would explain why some of those states have such different numbers than Michigan?
That's a great question. I think for the spike in Michigan is a combination of 4 or 5 different things. As we mentioned earlier, the new variant strain, Michigan has some of the highest or second highest case in the country of new variant strains. And this new B117 variant is much more infectious, spreads much more quickly. So we have that issue. I do feel it's hard to say whether we have more fatigue than other states, but I certainly see it in Michigan that we're not being as vigilant with masking and social distancing. You think about everyone sheltering in place a year ago, and certainly I'm not suggesting we shelter in our homes, but I think just even following social distancing and masking, there's a lot of fatigue and people are just tired and they're not being as vigilant. I think that we've opened up us socially to a pretty big degree. So, we've opened up restaurants up to, I believe, 50%. We mandated that schools be open potentially full-time for all children. We've opened up spring sports. So we have seen spread in the younger populations. And again, that's probably not unique to Michigan. I think that We did such a great job the second half of 2020. I think the governor was very cautious and worked very hard to try and prevent the loss of more lives. So we were shut down significantly in the second half of 2020. And so that protected a significant part of the population. And so it actually, by us opening everything up so quickly, perhaps a bigger proportion of our population was more vulnerable right now because we hadn't had infection, thankfully, in the past as much as we could have. And now that if people are not masking and social distancing, and the virus has entered our younger population, so kind of a perfect storm with it being spread very aggressively in our community. All of these things together have probably pushed Michigan to the forefront.
So basically, the states that didn't have the same restrictions, more people had it in the beginning, but they didn't have the variant that is more contagious that we're seeing here in Michigan?
Well, I don't want to make too much of that, but it is possible that we have a little bit, we had more protection, or we weren't as vulnerable back then, but we are more vulnerable now. But I do think the 4 or 5 other factors that I mentioned also contribute. Us having the highest number of variant cases, the variant being the most infectious, us opening up socially, at the same time this was all happening, kind of led to a perfect storm. So I think that was what you point out as maybe one of 5 factors that all contributed.
Right, and everyone is traveling like crazy right now.
That's absolutely true. And we've seen it in the school systems where, the week after spring break, there's been an explosion of cases. So, and it's not just the schools. We've seen an explosion of cases in everyone under 50. So it's been tough.
Dr. Chen with us here on the Megacast. She's Chief of Medicine at Henry Ford West Bloomfield, but also an infectious disease specialist. Doctor, if we can jump ahead to like a month, what are your predictions? If everyone gets the shot that can get the shot, will we be working our way out of this pandemic?
I think right now is a really critical time. I'm not sure that the state of Michigan and everyone here understands how severe things are and how careful we really need to be and vigilant for the next 2 months. We've actually increased our number of cases for 7 straight weeks, and that's record-breaking in a bad way. So we really have to all come together right now in this upcoming month and practice social distancing until we can all get vaccinated. And as you know, it's, whether it's 1 shot or 2 shots a month apart. So I do think that in the next 2 or 3 months, a much greater proportion of Michigan could become vaccinated. And I think hopefully we can encourage everyone to take that opportunity to protect themselves and their families and their loved ones by doing that. And I think until we can make that happen, I would strongly encourage everyone to be really vigilant because we are actually reaching a really critical point now where people are the rates are astronomical, and we see so many hospitalizations, critically ill people, except now they're young and critically ill, and that's equally devastating.
So what about the treatment? In the beginning, we were hearing so much about plasma being used as one of the treatments. We're not really hearing too much about that. Should people still be donating like they once were in the beginning?
Actually, yeah, you're right. The data with and we have so much more data now than we did a year ago. A year ago, it was a great theory, but now we've got many scientific publications suggesting that the convalescent plasma is not very helpful. What we have found very helpful is that people who are early in their COVID infection, actually there's only 1 treatment at this time if you're not critically ill and you're outside the hospital and safe to be at home, and that's monoclonal antibody. And that has shown some good results, scientifically proven. And we are giving that to patients who are, we call high risk. If you're more elderly, if you have coexisting conditions, diabetes, immunocompromised, obese. So that would be one option for people to strongly consider. I would strongly say you actually should not be taking steroids at home if you're not critically ill and short of breath and hospitalized. Really, steroids should be reserved for people who are hospitalized, because that is a really common error we are seeing by primary care providers and urgent cares in the community. And then, of course, if you have symptoms, I would urge the listeners, if you have any kind of symptoms of shortness of breath, feeling a little more short of breath when you walk, you urgently need to be evaluated for possible admission and treatment in the hospital, where most of our treatments are given.
So with that, Doctor, when we're talking about the vaccine, there's still that debate out there between the different types of vaccine. It's been around long enough now. We know some people have side effects, some people don't. But do you think for us to really get to our herd immunity, doctors, our primary care doctors, need to start getting the vaccine to be able to give to their patients as well?
That would be great in an ideal world. We simply don't have enough as a nation to be able to distribute it to offices. Even hospitals are being given a limited amount. Really, the state is, distributing it in mass centers such as Ford Field and the health department, and through pharmacies is the way that they've chosen to go, which I understand that's accessible to everyone. So yes, in the ideal world, that would help speed up immunization, but really we're limited right now with the number of vaccines available, and we are working hard to distribute everything that's available through the channels that we just mentioned.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. With that, Doctor, we want to remind people, because some people want one shot versus the other shot, the best vaccine is just whichever one you can get.
100% agree. All three vaccines are excellent. All three are very effective. All of them help prevent serious hospitalizations and deaths, which is the most critical point. So any of the vaccine that you can get, you should jump at the chance.
Doctor, anything else maybe I didn't ask that you want to chime in on before we say goodbye?
I would just like to end with this. We worked so hard as a state and a country for 1 year to do all the masking and social distancing, and made so many sacrifices socially, economically, to do that. And actually, I'm not sure if everyone realized, but it was for one goal. It was so that everyone could get vaccinated and we could get protection and what you call herd immunity or community immunity through vaccination. So I would strongly encourage everyone, until you can get your full immunization, to please continue practicing safety. And I would please ask everyone to strongly consider getting vaccinated, because if we don't come together and get vaccinated as a country, all of these sacrifices the past year have been for nothing. And so really it's been to this driving point. We made these sacrifices for a year, and we've been working hard to try and save as many lives. And now we all need to get vaccinated so we can, have a safer future.
So I know that there's been, you probably don't know this, we don't know this yet. Do you anticipate this is going to be kind of like the flu shot, where we get it, usually annually, or could this be every 6 months, every year?
Yep, that's a great question, and I think there is a possibility that we're all considering that this might need a booster in the future, whether it's annually. I think more information is going to be known, and that's exactly what they're studying now. Now that we're getting vaccinated, they're studying patients to see how long do we have the antibody, how long would we be protected for. So I think more information to come, but I know our country is one of the most prepared in the world. So we're very lucky to have the resources we have here. And so I know that we'll be able to protect the country if everyone can agree to get vaccinated.
Well, I'm sure you're vaccinated. And so, Sam Adams is getting in on trying to encourage people to get the vaccine. So if you post, and hashtag shot for Sam, you could get a free beer out of this. And I think all of you on the front lines, you all deserve it, and you probably need it.
Thank you.
Well, thank you again for being with us. We always appreciate your time.
Thank you. It's a pleasure.
Dr. Chen with us here on the Megacast, Chief of Medicine at Henry Ford West Bloomfield Hospital. And we are hearing so much about getting the vaccine, Tyler, not even so much for ourselves, but for the community.
Yeah, because we got to work together to get out of this. We've seen time and time again that as cases rise and people get more frustrated and we keep wondering, when is this going to be over? Is it going to be another couple of months? Is it going to be another few months? Are we going to be out of this by the time summer rolls around? Are we going to be out of this by the time that summer is done? And as we have these spikes, we push that forward a little bit further. And the only way to really speed that up, or the most effective way to speed that up, is to get people vaccinated. So anything that we can do to speed that along, even if it's just one person to one person, it's going to be helpful for the entire community.
We're going to take a quick break here on the Megacast. When we come back, we'll be joined by the mayor of Rochester Hills. This is the Megacast.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys.
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping, taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine.
Quitting smoking can improve your health, but it also protects your loved ones from secondhand smoke. Did you know there's no risk-free level of exposure to secondhand smoke? Smoke from cigarettes, e-cigs, and hookah can travel through ventilation systems and harm those around you. So clear the air and stop secondhand smoke. Call the Michigan Tobacco Quit Line at 1-800-784-8669. A message from the Michigan Department of Health and Human Services.
Thank you for taking time out of your day to be with us here on the Megacast. As a reminder, we're always here Monday through Friday, 10 a.m. until noon. So many communities, Tyler, are still, navigating the crisis. And Rochester Hills, this is a tough time for so many of our elected leaders to continue to try to help guide all of us through this pandemic. Talk a little bit more about what's happening in Rochester Hills. We're joined now by Brian Barnett, the mayor. Thank you for being with us.
Hey, good morning. Thank you for having me.
How are things going over in Rochester Hills?
Well, I think we're doing okay. I mean, obviously, this third surge has been a bit of a mystery and a surprise. Obviously, you've all seen the heat maps that suggest we're sort of a one-state outlier relative to the amount of cases we're seeing, and we are, certainly seeing that in our city family as well. We've had probably more people off with COVID in the past 3 weeks than we had in the first 6 months of the pandemic.
Wow.
But we are, our team, I think everyone except one is back, and we're continuing to do all the things that we're known for: good governance, hopefully service to the community, and just having to do it a little differently and continuing to manage those precautions because this latest hit of COVID has been substantial.
So can we talk about your budget right now? How is that looking? Do you anticipate getting some type of relief from the federal government?
Yeah, we do. Obviously, I was an outspoken advocate for that nationally about the need for cities to receive direct funding. It was a portion of the president's plan that I supported that portion being the monies that came directly to cities. And so I was talking with some of my city colleagues last week, and we know about the amount that we're going to receive, and it'll be a tremendous boost for us to be able to fill revenue gaps that we missed from last year, and to begin to kind of stabilize some of the things that we're a property tax state, so we've been okay, but there are a lot of things that we missed out in terms of revenue on. This will be able to fill those gaps, and we've always been really conservatively financially managed, been consistently ranked in the top 2% of cities for financial strength, and so we don't anticipate any challenges that would impact our bond rating or impact service levels, but we're going to have to be very mindful of that moving forward.
We're talking with Brian Barnett. He is the mayor for Rochester Hills. With that, too, how are you guys doing meeting-wise? Are you still doing those virtually? And do you anticipate that's going to continue for the remainder of the year?
Yeah. No. Actually, this week we have our first in-person meeting in over a year.
Wow.
Our council chambers have been reconfigured, so it's a hybrid. The council will be in the chambers, and as will I and my administrative team, and any residents that choose to show up. But you can also continue. I mean, we've been sort of accustomed to Zooming and other platforms to engage virtually. So we'll have the opportunity for residents to either engage virtually or in person, following the recommendations of the CDC and of the state of Michigan.
I will say, as a resident, I like that process so that I think more people could actually get involved with their local government. But we know this is only allowable due to the pandemic, right?
Right, but I think we've actually talked with our team about how we make this more a part of how we do business in the future. I mean, it may be some people may never be comfortable coming into a relatively unfamiliar building or unfamiliar surroundings, and so if we still value those voices, we want to find a way to continue to hear them and engage them. And so my guess is that many municipalities will look at, for example, one of the ways that they could use the funding they'll be receiving from the government is to equip their buildings, or they could choose to equip their buildings with ways to continue in a hybrid format where you could both contribute online and in the past, of course, you could watch. It was just not possible to interact, and we had to purchase some technology and retrofit some things. It cost us some money, but I feel like this is probably the way of the near future and maybe even longer term.
So with that, of course, everything right now, the focus is on the vaccine. How is that rolling out in the city of Rochester Hills, or are you pretty much just relying on the county?
Well, most cities, I think with the exception of Detroit, don't have their own health department, and so we rely on the county to lead that. Of course, we work with many of our private institutions, whether it be the hospital systems, Ascension in our community, or some of the other for-profit organizations, Meyer, CVS, and others. We've done pretty well. I mean, I think we're ahead of all the averages in terms of those that have wanted to get vaccinated. All of the folks associated with our school districts have been vaccinated, should they choose. All the folks associated with the city, that's very recent, have been given appointments in the last week or so, and are being vaccinated, those that want it. So I think we're doing as good a job as possible. It's a challenging process, but I think more and more people are being vaccinated. We've set up a vaccine hotline here at the city, helping to direct and connect people where they needed to go. Of course, at the very beginning of this process, it was very uneven and even somewhat mysterious to folks, especially when it was a 65 and older crowd. So we've been trying to be strong assistants provide strong assistance along the way, and I'm really proud of our team for that.
I think it's great that you did a hotline because we know a lot of seniors don't have the internet, or if they do, they can use it with limited capabilities. So sometimes you have to go back to the old-fashioned way of doing things.
Absolutely, and a lot of folks, it was just having a voice. They'd call and they'd be 1,000 people. That's not a joke or a rounding error. 1,000 people ahead of them on the phone, and some people were on hold for 8 hours. So just to have a friendly voice saying, "Hey, listen, we're going to stay with you. We're not going to leave you hanging here. We're going to get you the information that is important to you. And I think that we provided some level of comfort and counseling along the way, which is sort of a side benefit.
So Mayor Barnett with us here on the Megacast. Mayor, I anticipate the conversation going forward with the vaccine is going to be about requirement and the so-called vaccine passport. As an elected leader, do you anticipate those conversations are going to come up in the city of Rochester?
Well, I'll let Amanda speak for the city of Rochester and I see her there for Rochester Hills. No, I mean, listen, and you've heard the president speak pretty definitively about this. That there will not be national mandates for this. Locally here, you've seen leaders like Dr. Peskovitz, the president of Oakland University, talk about vaccines being required unless you have a religious exemption to live on campus at Oakland University in the fall. We don't control any housing here. We don't control, we don't have any public transportation that we would have authority of. So there's no reason for us to get into that game. I think that's probably the next level of discussion nationally that people are going to have in terms of, what may or may not need a vaccine to participate in. But right now we're just trying to get vaccines to those that want them, and that's a pretty heavy lift. And that's really what we're focused on, and the other things will sort of take care of themselves and be really vibrant discussions that people are obviously pretty passionate about.
So if we can shift away from the conversation about vaccines and COVID-19 for just a minute, I know you guys have an exciting project underway, Innovation Hills Park. Do you want to tell us more about that?
Yes, it's like my third child. I love talking about that park. Now, we just specifically what we've just launched is a campaign for the community to show their support. So far, we've put millions of dollars in this, all from the private sector, nonprofit groups, and we're building a $4 million playground out there over the next 90 days. And we have another boardwalk loop going to the council this month. So this campaign, which you can find at rochesterhills.org/playground, is a chance for the community. If they've been out there, if they've enjoyed it, we partnered with the MEDC. They're going to match dollar for dollar the next $50,000 that's donated in the next few weeks. And so we're encouraging people to contribute. We'd love to see families who've enjoyed an experience out there contribute $25, $50, maybe $100. We've had some students contribute $20 because they had a unique experience out there. It's just kind of a good old-fashioned community fundraiser to show support for this project. And we've been overwhelmed with the support that we've received so far, and we think we're going to reach our 50,000 goal well ahead of schedule. And again, if any listeners want to or viewers want to contribute, it's rochesterhills.org/playground.
Hey, even if it's $5, it all adds up.
All of it adds up, and it creates a great story. And anytime you have community buy-in to a project, you're raising funds and you're raising friends, and both are equally important when you want to advance something new in the community. And so we're excited about this effort. We appreciate their partnership with the MEDC, and we're looking forward to hopefully meeting that goal, coloring in the thermometer all the way to the top, and celebrating more investment into our incredible new park.
So do you want to talk a little bit more about the playground? Because am I reading this correctly? It's going to be designed so people with disabilities can enjoy it as well?
Yeah, it's really a unique endeavor, which is why sometimes the price tag can be a hard swallow. But we wanted everyone in our community of all ages and all abilities to be able to enjoy it. And so when I asked our team to put this together, I said, here's what I don't want. I don't want anything you can find in any other playground within a 2-hour drive. I want all unique elements here. And so we've got this giant tree that's like this 3-story tree. You actually enter the playground on the second level, and you slide into the playground to get into where all the fun stuff is, parents and grandparents alike. And so we've got a river right now. They're digging the river that's going to run through the playground, which kids will be able to manipulate the water flow and learn and see how the river changes things. And really, we've worked with OU Cares, which is an autism group that to really plan everything the way it's laid out, from the colors we use, from the sounds you'll hear, from the way you enter and exit the park. We've tried to really have a really all-encompassing focus on that so that every guest has an opportunity to have a unique play experience at Innovation Hills.
What's the timeline for completion?
I want it done by Friday, but they tell me that's humanly and physically impossible. And so then I say next Friday, and they say, Mayor, same thing. So generally, we hope to have it done by the beginning of June this year. So like I said, it's out there now. We actually have a time-lapse camera that's capturing all the changes happening every day, and we're excited to see this. And I'm excited to play on this playground, hopefully by the time school gets out in mid-June.
That is so awesome to have that in the community, because so many people are taking advantage of our parks now more so than ever.
Yeah, we recognize that throughout this course of this last year. In fact, in the first month of the pandemic, our parks usage was up like 350%. I mean, where could people go last year that they could feel safe? And it was outdoors, and it was on the trails that we share with the city of Rochester, and all the great public spaces that we have here in our community. And so, we took a look at this and said, this is, some people are kind of pulling back and say, no, this is where we absolutely should invest during this time, because if the one thing that our people have told us is that when times get tough, they like to go outside. They like to recreate close to home. They're not flying overseas, they're not flying a lot of places. And so this makes sense for us to invest their money into their parks and to do it in a really unique and important and impressive way. And that's what we're doing. We've got that project, another project. About the same time, we're going to open the city's first splash pad on the south end of town. And so residents of Rochester Hills, we're kind of calling this the summer of fun. We had a tough summer last year, but we're excited to celebrate with some really unique, cool outdoor spaces all across our city this year.
Summer of fun. I like that. I may steal that as a slogan.
Oh. You send us a nickel to the playground every time you use it, and you can use it as many times as you want.
There you go. Mayor Barnett with us here on the Megacast for the city of Rochester Hills. Mayor, anything I didn't ask that you want to touch on before we say goodbye?
Just encourage our folks to continue to be vigilant. Thank the folks out there that are doing a great job. We are really standing with our small businesses as they've been challenged, and trying to communicate as best we can. I launched a new podcast to try to continue to communicate with our residents. So proud of our team, proud of the way the city of Rochester Hills has responded, and just want to keep people diligent and vigilant in the remaining months here to hopefully get to the summer of fun as quickly as possible. So thank you for the opportunity this morning, Ronnie. Appreciate you.
Great talking to you again. If you do want to donate to the park, it's rochesterhills.org/playground. We're going to take a quick break here on the Megacast, and when we come back, we'll be speaking with the Community Engagement Manager for the Detroit Institute of Arts. This is the Megacast.
Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. The thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful, because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
Finally, I just got my COVID-19 vaccine.
I registered with my local health department and they called me.
I got mine at the pharmacy, and my neighbor got hers from the hospital.
I'm not a techie person, so I called the COVID hotline, and they helped me schedule an appointment.
Get vaccinated with the first vaccine you can. Protect us all.
Learn more at michigan.gov/COVID vaccine. COVID-19 has caused many families to fall behind on finances and on groceries, but you're not alone. You shouldn't have to worry about putting food on the table. My Bridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services.
I want to get back to seeing my grandbabies every Sunday and smothering them with big hugs and kisses.
I want to get back to football games with my boys.
I want to get back to feeling and touching, connecting with the people around me.
I want to get back to family dinners and my grandma's mac and cheese.
I want to get back to real grocery shopping. Taking my time, walking down every aisle, smelling the tomatoes and melons, having a free sample or two, or 3.
COVID-19 has changed how we live and how we feel. But now, there are vaccines. And they are the first step that let us get back to feeling optimistic about the days ahead of us. It's okay to have questions.
Is it safe?
Should I get it?
Should I wait?
Now, get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you. Brought to you by the Ad Council.
We want to say thank you for being with us on this Monday. As a reminder, you can always catch us on Civic Center TV, Birmingham Area Municipal Access. If you have cable, thank you. A portion of your fee helps support programming such as this. You'll find us on Channel 15 if you have Comcast, 99 on AT&T. You can also listen to us on the radio, 89.3 Lakes FM, 88.1 FM The Biff. And then today we are live streaming today's edition of the Megacast on my journalist page, Ronnie Dahl, so you can catch us there today as well. Did you know that the DIA was founded in 1885?
Really?
Opened in 1888. I knew it's been really a part of our community for a long time. I didn't realize it's been around for that long, but it is a jewel and a gem. But like so many other organizations, they're struggling right now due to COVID. To talk a little bit more, let's bring in Amanda Harrison. She's the Community Engagement Manager for Oakland County for the Detroit Institute of Arts. Thank you, Amanda, for being with us.
Thank you, Ronnie. It's a pleasure to be here.
So I know that the DIA recently closed due to a surge in cases in COVID. Are you reopened yet?
We have reopened. Unfortunately, we did close for the week of April 5th briefly, but we have been able to safely reopen. We're asking guests to register in advance for a time slot on our website, dia.org. And then we are limiting capacity to 25% right now, but everything is open and we have several special exhibitions going on, including Detroit style car design of the Motor City.
So the special exhibits, do you have to pay additional for those?
No, those are all free to Tri-County residents. So if you're living in Oakland, Wayne, or Macomb County, it's actually your tax dollars that pay for those exhibitions.
Oh, that's great, because I know some you have to pay an additional fee when they get some of the special big exhibits that come in, so that's great to know. What prompted the closing last week?
Our leadership team has been watching closely the rise in cases in the in the state of Michigan, and we felt that for the safety of our members and the local residents, we wanted to temporarily close to try and mitigate those spikes and not contribute to them. We are following very rigorous protocols to keep our spaces clean and to keep capacity and numbers down as much as we can. But we also know that we're a public institution, we belong to the public, and we want to be as accessible as possible. So we reopened as soon as we felt it was safe.
So with that, Amanda, I always wonder about establishments such as yourself. Because of COVID, everyone is cleaning so much more. How do you maintain that level of cleanliness, but also not risk damaging the artwork that's in the museum?
Of course. Well, we have a conservation team that, is highly specialized, highly trained. They work with the art. We have different team members, actually, who have been redeployed to be, so everything can be touchless. No one's touching doors. They're monitoring the bathrooms to make sure that there's only one person in the restroom at a time. And because we have just one person opening that door or counting the number of people in a specific room at one time, it's really their presence that's helped helping to make sure that you have a touchless experience when you come to the museum, which is funny because it's a little bit opposite of the direction we were going before COVID, which was to be more of an interactive museum with hands-on experiences. So it's been a pivot, but our team has adjusted well.
So how is the numbers right now? Are people starting to come back to the DIA now that it's reopened?
We have seen very positive numbers. We have been meeting some goals, but I think what we've really seen is an increase in our online activity. So even though we have special exhibitions going on right now, if you're not comfortable coming to the museum, we have everything. Our entire catalog of 67,000 pieces of artwork is available to you online, and you can browse those catalogs, and then also participate in some really special events. Last Thursday, we had an hour-long program on Detroit Style, that exhibition that's going on until June 27th, where we discuss the specific pieces of art in that exhibition. We actually have 12 vehicles, sedans and cars on display, and we have videos of how we got those vehicles into the DIA and had a discussion surrounding that. That was a lot of fun, and it was all available online, and people could participate and ask their questions still, but really from the safety of their own home.
We're talking with Amanda Harrison. She's the Community Engagement Manager for the Detroit Institute of Arts. Amanda, are there any plans right now to try to bring back some of the special events that you used to do? You'd have the orchestra or some of those types of specialty events, or are those all on hold until further notice?
So right now, those have all migrated to a virtual platform. So we are still offering films, we're still offering live concerts and lecture series. Right now, our Detroit Film Theater, it remains one of our most popular features despite being closed. We have the 2021 Academy Award nominated short films available for viewing at home this year. Instead of coming to the theater, you can view those at home. And you'll be able to choose from a variety of topics, including documentaries and animated films, and they're at a very low cost to the viewers. And then the majority of what you pay to watch at home goes back to the DFT to support it, even while we are closed, to help preserve this historic theater.
It really is amazing. I know a lot of people locally, they typically will go as kind of a field trip, when you're in school, but then they forget to go back and take advantage of what's in our backyard, because we do know that, our tax dollars are supporting this entity. So if someone is coming for the first time, what can they expect?
Oh, first-time visitors are my favorite because the Detroit Institute of Arts is, as you said, Ronnie, in the beginning of this program, truly a gem in the community. I don't think people realize that we are ranked in the top 6 in terms of museums for North America. We have one of the most important collections in the state. We were home to the first Vincent van Gogh to enter a United States collection. We're home to Peter Bruegel's The Wedding Dance, which is one of only 2 Bruegel paintings in the United States. And then we also have Detroit industry murals, which are considered a national treasure. These were designed in the 1930s by one of the most famous muralists, Diego Rivera. And those are a real gem. If you walk into Rivera Court, you can feel the power and the history. It's a unique history being told within our museum that you can't find anywhere else.
Well, there was so much controversy around the DIA throughout the bankruptcy, but it survived the bankruptcy unscathed. But recently, obviously, there is a lot going on. 7 board members recently walked out. What is going on behind the scenes at the museum?
Absolutely. Well, as a public institution, I think that it is very important for the public to be informed and to be as transparent as possible, and then to be held to a higher level of standard and scrutiny. So there have been concerns raised by employees and discussion among board members. And I'm not in those conversations, but what I can tell you is that our board is responding to criticisms and our staff is responding to criticisms to really meet the needs of our employees and our citizens. So we have implemented a couple of new procedures. We have previously reported that a new role was created, a board employee relations liaison. So now we have a specific person as an employee. If I have any concerns, I can take it to our new board employee relations liaison and address any concerns that I have or any other employee has with her specifically. And we also have a confidential hotline that's been established. So if there's an issue that needs to be discussed, we can make that concern known on that private hotline. So there are new things being addressed. We've also launched what's called the IDEA Initiative. These are starting as workshops. We've contracted with an outside organization to help make sure that we're promoting inclusivity and diversity within our staff, and to make sure that everyone is heard and concerns are addressed appropriately. So we've all been participating in those workshops, and I think that it's refreshing to see such positive movement going on in response to some of these criticisms that have been made.
Well, because behind the scenes, it has to be stressful to go into work with all the drama playing out, but at the end of the day, you still have to serve the people that want to visit the institution.
I will say that for me, personally, it's an honor to be working at the DIA. I understand how important this institution is to not just Southeastern Michigan, but to the world we're looked at. We have a piece on loan right now in London. I'm sorry.
That's okay.
Jim Glessy's Artemisia. It's one of the most important works by this artist, and what I am really excited to get back to is talking about the work and talking about the collection and the public offerings that we have. I feel so fortunate that working at the DIA, because of our funding structure, because we are a publicly owned institution, there were no layoffs that were done. I still have a job, no layoffs happen, and we're able to help support artists during this very difficult time by having artists do artist demonstrations from home. So just recently we had Jennifer Sakarian, who's a printmaking artist, come in and do a demonstration for the audience on the artwork that she does and is known for. We recently had a concert. It was a tribute to jazz musician Fats Waller, done by Elvin Waddles. That was a live performance that we broadcast from our Crystal Gallery. That was really powerful and fun. We had a fun discussion around that. And it's so nice to be able to support artists who are suffering due to COVID, due to the shutdown, because we can't have live performances. We are still able to help these artists in different and unique ways, and we have the opportunity to do that through the DIA.
And with that, if I can ask just one last question about the leadership. I know that the museum did hire an attorney, a law firm, to come in and try to, be the outside eyes on the complaints that were coming out from staff members and former employees. Who paid for that attorney? Do you know?
That it would not be a question that I would be able to answer. That would be a decision made by our board of directors, and I'm not in those conversations.
So, and we just, one of the things is just, this is, it's tax dollars that support this. And so, dollars are so tough right now for so many organizations because, the fundraising efforts and so many of the events are having to be canceled. And I know a lot of people like to get married at the DIA. It is an incredible backdrop.
It is. It's a beautiful venue. I am appreciative of the initiatives that the DIA leadership is taking, though, in terms of transparency, because we are a public institution, and I think having an extra set of eyes, including through a law firm, to evaluate and make sure that we are doing things in the public's best interest is very important. So I'm appreciative of the work that's being done, and hopefully we get back to weddings very soon, because it is such a beautiful venue to be in.
So with that, what are the hours right now that you're reopened?
So we are operating unlimited hours. We're only at 25% capacity. So we're asking people to make a reservation in advance. You can do that on our website, dia.org. And we have limited our hours because we want extra time for cleaning to meet those cleaning protocols. So it is changing based on activity. So I'd encourage you to go to our website for updated information. It updates constantly, but right now we are closed Monday and Tuesday. We're open Wednesday through Friday from 9 a.m. to 4 p.m. and Saturday and Sunday 10 a.m. to 5 p.m. One thing I do appreciate though about our leadership at the DIA is that they are prepared to close if they feel like it's unsafe.
Are you still hosting field trips right now?
We have field trip access available online in a virtual space. Our gallery teachers are really great assets, I think, to our public school system. They develop lesson plans for teachers to use in the classroom and used to offer different programs, obviously in person at the DIA, that connects children with the artwork in our collection in really unique and interesting ways. Just to give you an example, we had an activity about Think Like an Engineer. It's a STEAM program that we had in relationship to our exhibition, Detroit Style. We made the lesson plan, the presentation, all the graphics, questions, sample questions, all available as teacher resources online. This is something that we would have just offered through the museum, but now any teacher can go to our website and access that information. And they're essentially lesson plans available to teachers or parents at home who need additional activities or help for their students.
So do you anticipate programs such as that will stick around post-pandemic if we ever get there?
I think that we are all very eager to have children come back to the museum. One thing I do see sticking around is the broadcasting of our senior programming. We're reaching new audiences that we never would have reached before because we're now broadcasting our lectures and our concerts online. We're meeting a need of a population, maybe homebound seniors, maybe people with mobility issues, people who can't access the museum now have access to these programs because they're being broadcast, and I could see that staying.
That's great. Amanda Harrison with us here on the Megacast, the Community Engagement Manager for the Detroit Institute of Arts. Anything, Amanda, maybe I didn't ask that you want to add before we say goodbye?
Well, Ronnie, I really appreciate you having me today and for the time. I'd encourage your listeners to please see what's available to you online. And we're still out in the community, too. So we have several projects going on. In your local community in Beverly Hills is going to have our Inside Out project, which brings reproductions of DIA artwork into the community. We also have 2 murals starting this fall. One is going in Rochester and another in Berkeley. And in the city, I know you had Mayor Barnett on earlier today in the city of Rochester Hills. He talked a little bit about Innovation Hills. Inside Out is going into that park as well as along the Auburn Road corridor that I'm sure he talked about. So we have lots of, actually 23 locations for Inside Out in Oakland County this year, and those 2 murals that we're really excited about. So if you're not interested in online activities, if you're not feeling safe visiting the museum right now, we still want to come to you and meet you in your community.
It would be a great, kind of challenge for parents and their kids to go find all 23.
Yes.
That'll keep them busy. Well, Amanda, thank you again for being with us.
Thank you, Ronnie. You have a great day.
You too. We always appreciate your time. DIA.org. Go on. As a reminder, you need to reserve your tickets. When's the last time you've been to the DIA, Tyler?
It's been several years since I've been down there, so it's time to go back.
The building is just. It's a piece of artwork itself.
It is.
It is so incredible. So if you get a chance, again, it's right here in our backyard. Our tax dollars support it. Take advantage of it. We're going to take a quick break here on the Megacast, and when we come back, we're going to talk about beer. That's next on the Megacast.
Right now, our country feels divided, but there's a place where people are coming together.
I was nervous to talk to someone so different than me.
Me too.
Love Has No Labels and One Small Step are helping people with different political views, beliefs, and experiences connect through conversation, and it feels good.
This conversation gives me hope.
It gives me a lot of hope too.
Take a step toward bringing our country and your community together. Start a conversation at lovehasnolabels.com/onesmallstep. A message from StoryCorps, Love Has No Labels, and the Ad Council.
Over a decade ago, the journey to a COVID vaccine began. Building upon research on other coronaviruses, scientists continued with months of research and development, 3 phases of clinical trials with tens of thousands of diverse volunteers, then peer review and authorization to deliver a safe and effective vaccine that will protect all of us. Discover the facts for yourself at michigan.gov/COVID vaccine. Wearing a mask is more than protection. It's a bridge to better days. The path back to celebrations with family. Nights out on the town with friends. Game days with your favorite sports teams. And the thrill of live concerts. But until we can all get the COVID-19 vaccine and build community immunity, which will take time, we all need to continue to stay careful. Because Michigan's recovery is depending on you, and so are your family, friends, and neighbors. So even after you're vaccinated, wear a mask, avoid large gatherings, and social distance. One day in the near future, we will all be able to put this pandemic behind us. But until then, spread hope, not COVID. Learn more at michigan.gov/coronavirus. A message from the Michigan Department of Health and Human Services.
Just about 15 minutes left here on the Monday edition of the Megacast. And what a great way to end the show.
Yes.
Talking about beer. Joining us now, let's bring in Jeff and Jennifer Smith. They are the founder. And Jeff, you're the head brewer for Loaded Dice Brewery.
Yes, I am. Yep.
Okay, you guys have a fascinating story. Tell us again, like, how you got started.
Well, I started home brewing about 20 plus years ago. You see a lot of gray in the beard, so it indicates my age. We're kicking around ideas of what we knew we both wanted to start something for our own, and it was going to be a barbecue place. It was going to be a brewery. We had a couple other ideas, and we just really went all in on doing a brewery. We started this process in November of 18, and we opened up the doors right smack in the middle of the pandemic in September of 2020. But it's been a lot of fun, a lot of work. We've had tremendous support with the community. Just the organic growth that we've had since we've been open has just been amazing to me. And her, I assume. So
with that, Jennifer, we'll bring you into the conversation. What's it been like for you? Were you a little nervous to go ahead with your opening plans?
Always nervous. We didn't want to get ourselves in trouble right off the bat. We had a large following already from social media, so we were a little worried about what that quantity would look like. But you know what? Those people have been with us on the journey the whole way and have supported us through it all. So it took off really well and is still continuing to grow, so we couldn't be happier.
I feel like the craft beer industry is a community within itself. And
for sure.
So what's it been like because of the closings and the opens and the restricted hours? We know as a new business, it can be hard to get some of the federal funds because you were open last year to be able to provide your tax returns. Right. What's that process been like for you?
It's been a cold, really hard stop on all of it. As soon as I speak to somebody who gives me like a little glimmer of hope, they're like, oh, you didn't have any revenue in 2019 and we don't have any employees. Because when we opened, we planned to staff up, but with the pandemic, there really wasn't a need to. And plus, we both decided it wouldn't be fair to someone to hire them and then have to probably turn around and furlough them or lay them off. So we just been working hard, us, her and I alone. We do have some help from my, family and friends, but it's been really limited. It's just really, it's been tough because we want to go and bigger and do better things, but we have to gauge that based upon the availability of being open and what we can do and what we can have, here as far as capacity level.
Yeah. So when you see the numbers surge, does it stop your heart a little bit? Because you're like, if we get closed down again, how are we going to survive?
That's probably one of the benefits of being a new to the business right now is we don't have any set ways. We're not a habit of, routine yet. Everything is new and adventurous to us. So we can keep moving and keep changing and keep shifting because we don't have, set routines that we have to do. So we've rolled with the punches, and luckily our followers have come along.
Yeah, one of our regulars told me about a week ago, it's like you just had like a really long soft open with a few pauses here and there. So
exactly.
It's been pretty it's caused a lot of anxiety. I mean, anytime you open up a business, period, it's going to be anxious. We've never opened up a business, let alone take on something like this. So it's been a huge learning curve, and we've had to pivot several times throughout this whole process.
And so I have to ask, because we do know so many couples are spending more time together than ever, a little bit more than what they want. And I'm looking at the two of you. I was so excited yesterday because my husband actually went into the studio, to the office. He left the house. I was like, oh my gosh, it's just me and the dog tonight. How are you two doing as a couple?
Well, because we've been able, we both still have our 9-to-5 jobs. And we've actually, because we also have kids at home, I work from the brewery during the day because I needed bandwidth to do my job of internet capacity. And with her being online and our 3 kids being online, it was next to impossible to do any kind of work productively. So I've been here. So like, we haven't had that dynamic to where we've been around each other all day, every day. But I mean, I like her a lot. So
it's been nice because we've been able to do the trade-off of who's got the more important meetings and needs to go to the quiet space, and who gets to deal with the Zoom crashes and and my internet's lagging at home.
Yeah. Right. We've all experienced that as well throughout this pandemic. So at least people are a little bit more understanding on the other end of that Zoom call, right?
Right.
So Jeff, now do you both brew, or is it mainly you come up with the different beers, Jeff?
I do probably 95% of the brewing. She's more of a chemist. I'm more of a chef, I guess, or she's more of a baker than I'm more of a chef. So she has been picking up a lot of the slack, with, not only just the brewing end of it, but the cleaning, which is, something I don't particularly care for, but need to do. And because I'm this, the one who's doing a majority of it, I can't keep up. So she comes in, and we actually have the kids that come in and help clean all the equipment and stuff like that. And she's actually been learning more and more as we go. And I want to put a little bit more of the brewing responsibilities on her, because there's no reason for her not to. She'd actually probably supplement me quite a bit in the regards of like precision and things like that, because when I say I'm a chef, I don't add a teaspoon, I add a pinch kind of thing, and she measures everything, levels it off. So,
but that's where he does all the cooking at home, because I'm not great with what flavor profiles and go together, and he'll just come up with something off the top of his head. I'm going to put this, and this together, and I'm like, sure, that sounds great.
So with that, we're talking with Jennifer and Jeff Smith, Loaded Dice Brewery. And so what are some of your most popular flavors of beer?
Well, we rotate out pretty regularly. So my whole thing for the first year was I have probably about 120 recipes I want to kind of blow through and then really pick out which ones we think perform the best. So far, we've probably identified a handful of them. So one of them is a Hefeweizen, which is a German wheat beer that I add a little bit of a smoke malt to it. So people say it's like a campfire feeling in a beer. So that's called Half Smoking Jacket. So that's been really well received. I do a series of stouts that I add in different adjuncts for flavors. Right now we have one on tap. It's called All In Stout, and it's flavored with coconut, caramel, and chocolate.
Ooh, that sounds like a good one.
Yeah, those are my favorite.
And then I have a series of New England IPAs that kind of go up the scale in alcohol content, and it's the side bet series. So there's easy side bet, juicy side bet, and boss side bet. So they go from 5.5% to about 7% to about 10.5%.
So with that, I know every year they do the big festival for the craft brewer, like craft beer. There's one in Grand Rapids and then the one downtown at Eastern Market. Tickets sell out. But this year, obviously, we weren't able to have those festivals. How important to your industry is to attend that, to be able to get word out about the beers that you make?
I think it's pretty critical. It's hard enough because, as you know, Michigan is a saturated market for craft beer. I mean, it's one of the better ones in the nation. And for new breweries, we have to rely on, word of mouth and social media. We can't afford to do massive marketing campaigns. I mean, we're a small brewery, like probably one of the smallest in Michigan. We have an 1,800 square foot space. We produce 1 barrel batches, and that's why we're able to turn things out pretty quickly and change directions on a dime. So that we were really looking forward to these festivals, really not only just to help get the word out, but also to experience it, because I've poured at festivals for other breweries, and it's been so much fun on that end. And I've been to my share of festivals too. So. It's something that we really wanted to be, get into, but it just hasn't happened yet.
So with that, what are your hours and where are you located?
So we're located in Troy, Michigan, on Maple and Rochester. So if you get off on Rochester Road off of 75, you'll head southwestish. But we're in a strip mall that doesn't face the street. It kind of goes perpendicular to it. Our hours, we are actually just added a day. We were originally Thursday through Saturday, but now we're going to be open on Sundays. So Thursday, Friday, Saturday, 4 to 9, Sundays, 12 to 5. And we do have food trucks. Pretty much every day we're open. And we rotate through a different variety of food trucks. We are closet foodies. So we like variety. Our kids are joining in on that as well, and they want different foods all the time. So we try to switch it up. We do have some regular ones that we really like, and they will work. They're great partners in this. We'll have back often, but for the most part, we kind of want to treat it like we're treating the beer and never really have a pattern. It's been a lot of fun finding these food trucks.
Oh, yeah. There was one, it was like a lobster and mac and cheese one. The line of cars, it was like all the way down the road.
That's crazy.
So it's very popular with people right now. With that, I have to ask, is it okay for people like me to come in and say, can I get a beer like a Corona?
We have that at least once a day.
Okay, so I'm not alone.
100%.
No, you're not.
It's 100% okay. I was once that person who wanted a Heineken or a Corona, and I wouldn't drink anything else. So I know what it's like. And while we'll probably won't have something like a Corona or a Bud Light, but I could steer you in a direction that's kind of comparable, and at least maybe get you started on the path of being a little bit more adventurous or get into different beer flavor profiles.
It's intimidating now to go in and pick out a beer.
Come on, it's easy.
Wine is easy. You just, depending on how much you like the people, you go to the bottom of the shelf or the top of the shelf. But beer, it's like, oh my gosh, I don't know.
Yeah, there's lots of different flavor profiles and different directions it can go. It's a very versatile product, and those are some of the questions when people come in and are like, I just drink this. We're okay, what other drinks do you like? And we'll give you something, that could match. Well, I like to have a bourbon every once in a while, or I like something more on the fruity side, and we'll put you in the right direction.
So it's okay to drink on the job then for the two of you?
No, yeah.
You have to test the product, right?
I do.
Exactly our saying.
And I make sure that people are aware if they're calling me on a 2 p.m. on Thursday or Friday, chances are I probably will be having a beer right next to me because I do have to test the products and see the carbonation levels and things like that. Now it's only like a little 1 ounce pour, but times 6 taps, times a correction time check, and it's day drinking's a thing, I guess.
Well, that's one thing here in the state of Michigan, right? It can't be open past 11. Everyone's like, that's okay, I'll day drink. We're talking with Jeff and Jennifer Smith. They are the owners over at Loaded Dice Brewery. Anything maybe we didn't ask that you guys want to add before we say goodbye?
Well, I do want to say that, we are in the middle of a residential area, and we have a lot of locals that come and walk or ride their bikes now that the weather's getting better, and we are dog friendly. And we also have a pretty decent outdoor seating area. We're trying, it's temporary because just different reasons. I mean, with Corona, we couldn't really afford to really bust out and make a patio, and the city allows us to kind of take a couple parking spots and do something with it for outdoor seating. But we're working on making that a little bit more of a better experience, so you're not just staring at someone's Dodge Caravan, while you're sitting there having a beer. So other than that, we just really pride ourselves in having a rotating tap list. I don't want to be the place that has that same IPA every time you come in. There is value in that, and I get it, but it's a little bit more fun than that to me. So that's kind of what we try to do here.
Again, check them out, Loaded Dice Brewery on Rochester Road in Troy. That's going to wrap it up for the Monday edition of the Megacast. Thank you to the both of you for being with us. We'll be back here tomorrow, 10 a.m.